Welcome, Kyle, and thank you for your time. And I'm really looking forward to this conversation, building on what we talked about in our last episode in how organizations are addressing the inequities that rural healthcare is trying to overcome. But why don't you start by giving us an overview of the Texas Hearing Institute, what it does, and what distinguishes it from other organizations that are serving children with hearing loss?
Thanks, Kelly, for having me. Texas Hearing Institute, actually, we're 75 years old. We've been around in the greater Houston area for 75 years and have been serving kids with hearing loss since that time. We started out as a school, but over the past 20 years have grown into as much of a school as a medical clinic as well, where we have audiology services and speech therapy services solely dedicated to working with children with hearing loss. As far as what makes Texas Hearing Institute unique is one is we are solely focused on pediatric hearing loss. So whereas many audiologists may see a few pediatric patients, their main focus is going to be on helping adults with hearing loss. So that's one piece. But I think the main piece that makes us unique and something that we call our secret sauce at Texas Hearing Institute is the fact that we have educators, speech therapists that are specially trained to work with kids with hearing loss, and audiologists that are specifically pediatric trained under one roof.
So we're talking about a unique population of families and patients anyway. So when we start with that, what are some of the challenges that families of children with hearing loss face if they're located in rural communities?
There may not be access to a pediatric audiologist. There certainly may not be access to a specialized speech therapy provider who can help develop those language skills for hours. So that's the main barrier, is just simply access to that care.
Well, I know that you have a passion for addressing those inequities in rural communities. So tell me, what is the Texas Hearing Institute doing in addressing these challenges?
Where a baby is born, their zip code should not impact the options that they have and the ability to develop language just alongside their hearing, typical hearing peers as well. So what we've found is that even though pediatric services may not be located in a community or in a region of Texas, there typically are other services that, with the right training and with the right support, could provide some of those services. So, for example, an adult audiology practice, a private practice, they have a lot of the basic equipment already in place. They have some of the basic knowledge, but they don't have the specialized training, the specialized experience, and maybe some of the specialized equipment. Mm-hmm. And so what we are working on doing is partnering with a private practice who provides adult audiology services in a rural area. And we will be remotely, our audiologists will provide care remotely while the practice is on the boots on the ground. So we can really provide full-scale audiology services for that pediatric patient, all the way from identification to intervention services. And then ultimately that can translate into speech therapy services provided virtually, and really take a mini virtual concept of what we do in Houston to any location in a rural area.
I think this is a great example of leveraging strategic partnerships and certainly leveraging the technical capabilities that we have now.
Our vision is that all children in Texas have the same amount of access to identification and intervention services. So we don't feel that we necessarily have to be the one providing it in every case. And so while we can and will look to establish that network, I think we will also look for partners that can help replicate what we've done. And we're hoping that we can create a model that others can identify and incorporate into their practice and help expand that network faster than what we could alone.
Fantastic. Let me ask you one other question. If a family is bringing their child to an adult audiology clinic for that telehealth connection with the Texas Hearing Institute, where you would in an emergency room maybe have child size IVs and things like even blood pressure cuffs and those kinds of things are important considerations when you're caring for a pediatric patient population. Is that as much of a challenge in networking with adult audiologists?
Yeah, it's a great question, and the answer is mixed and somewhat like an emergency room. That stretcher in the exam room is going to work for an adult or a pediatric patient, but like you said, maybe the blood pressure cuff needs a different size or so forth. And so very similar to that, that there are pieces of equipment that were already going to be there that will serve a pediatric patient as well. But there are some specialty equipment that we need to provide as well. That is where we would come in and help provide some of that equipment, either directly or through some of our partners, would be the hope for over time as well. And I think that's the beauty of how we want to approach this, is that we understand every community is unique. Every community has different level of resources, and we want to approach this to be open to what that community needs, both on the short term and then long term. And if a practice that we partner with becomes specialized and can provide the service on their own, and there's a great time for us to step back and let them be kind of take it and run with it, that would be almost an ideal situation, because that allows us to free up our resources to go help somebody else do that as well.
Well, it sounds really exciting, and like I say, I know that you have a passion for it, and I'm excited to see what you all are able to accomplish in the next year and 2 years, and laying out this map of addressing and overcoming those challenges.
Yeah, well, thank you so much, Kelly. Appreciate you let me come on and share our project, share what we're doing.
Thanks. You'll have to keep us posted.
Absolutely.